We're going to talk about toxic shock syndrome. So toxic shock syndrome consists of several symptoms, including confusion, chills, myalgias, nausea, and vomiting. So a patient will be confused, along with that have feverish constitutional symptoms such as fever and chills, myalgias, nausea, and vomiting. Physical exam will obviously show fever, usually above 102 degrees, and it's pretty high fever, hypotension, because it's an infection with either staph or strep that has caused the syndrome due to the various different toxins that the infection has created a toxin-based immunological reaction. And you'll see fever, hypotension, systolic blood pressure will be usually less than 90, localized swelling and erythema, a rash, and usually you'll see a diffuse macular erythema or erythroderma. So if the entire body is red, diffuse macular erythroderma is the type of rash you'll see in a staph patient. If it's the strep group A strep pyogenes that's causing the toxic shock syndrome, then it'll present with necrotizing soft tissue infection. But regardless, you'll see some sort of a rash, localized swelling, erythema, hypotension, like I said, and fever and a physical exam. And then the studies that you want to order in a toxic shock syndrome patient are obviously first and foremost the CBC, which will consist of possible leukocytosis with a left shift because it's an infection. So you have a shift to the left. And then you also have a BMP, a basic metabolic profile that you'd want to do, because that's useful looking at creatinine levels to see if there's any renal involvement. And renal involvement and renal dysfunction is a complication of toxic shock syndrome. Liver function tests, LFTs, are very important in toxic shock syndrome as well, because that may be elevated. Transaminases and also coagulopathy might be present. So you want to do that. LFTs are very important. Creatinine kinase, that's because you might see an elevated CK level due to the myositis or the necrotizing fasciitis that can ensue as a result of toxic shock syndrome. And then obviously it's an infection-based syndrome, so you want to do blood cultures and a gram stain. And then arterial blood gas, ABGs, are very important because you'll probably be seeing some sort of a metabolic acidosis due to the anaerobic metabolism, creating a metabolic acidosis type of a scenario. And so as a result of that, you'd get a respiratory compensation, thus you'll have low PCO2. So that's the compensatory mechanism. So metabolic acidosis with respiratory compensation, and then complications of toxic shock syndrome, TSS, is multi-organ failure. So that involves renal dysfunction along with the CNS system involvement. So thank you very much.